Good evening. On behalf of the Student Academy of Doctors of Audiology, I would like to welcome you to today's Student Practice Management webinar, Ethical Concerns in Audiology. My name is Andrew Abernathy, and I am pleased to serve as today's course coordinator. I have just a few housekeeping reminders before we begin. If you have any technical challenges during the session, please use the chat feature to make me aware, and I will be glad to assist you. Please type your questions into the question queue, and they will be addressed by the presenter at the end of the presentation. Today's presentation is being recorded and will be available for online viewing next week. At this time, it is my pleasure to introduce the course moderator for this session, Holly Botsam, SATA Education Chair and recent audiology graduate from the University of Memphis.
Thanks, Andrew. Dr. Hugert is an experienced private practice audiologist who owned several offices in the Atlanta area. She was co-owner of Hearing Doctors of Georgia for 35 years and has recently retired from this practice. She currently is consulting for an ENT practice in Atlanta, performing diagnostic testing and hearing aid selection, fitting, and rehabilitation. She is the co-owner of Georgia Equilibrium Diagnostics, an educational and consulting practice for vestibular testing and treatment of vestibular and balance disorders. She is an adjunct professor at Salus University, teaching audiology practice management and cerumen management. She is also an affiliate professor at Auburn University, where she teaches private practice audiology and professional issues. Dr. Hugert serves on the governor-appointed Commission of Deaf and Hard of Hearing Persons of Georgia. The Ethical Concerns in Audiology webinar will discuss our current ethical obligations and the laws that bind us to our code of ethics and scope of practice. Healthcare professionals are responsible for providing evidence-based practice and treatment decisions based on non-biased healthcare. Although there are abiding laws to our profession, we as doctors of audiology have ethical responsibilities to patients. We are challenged daily with that gray area of ethics that play a role in our clinical decisions and care.
Thank you, Holly. I appreciate the introduction, and thank you, Andrew, for walking me through the process of this webinar. And thank you to everyone attending and those of you, hopefully, that will be hearing this webinar. I love this topic. I think ethical concerns is so interesting from a lot of different perspectives. First of all, ethical concerns are not something that is static, and it definitely, there's changes in the way we view our ethics. And I'm hoping to go through several things that will, areas that will help with decisions that you will be making throughout your career, because pretty much every day there is something that comes up that you may have to make a judgment on. And it's not necessarily an illegal judgment, it's more a ethical judgment, especially in today's time. We have had some interesting areas that have popped up from this COVID-19 issue, and hopefully we can discuss a little bit of this. There's a lot of room for discussion. I think this area is so interesting, and it's nice to be able to kind of talk about different topics that come up. So I thought it would be kind of interesting if we could pose 3 different scenarios. My job today is not to be the policeman of ethical concerns for audiology, but I'm hoping that you know, when you look at different scenarios, that based on what you will know, the foundations and the footplate of ethics will help with your decision making for things that will arise with your practice in audiology. But I thought I'd take 3 different areas that I have recently researched and throw this in the pot here and let you think about them while I give this webinar. The first question, ethical concern, that I came up with was being that we have COVID-19, and as Holly mentioned, I'm currently working in an ENT office, and the way our office is set up, it's a very CDC, all the policies and regulations for COVID, it's following the CDC policies and protocols. However, I'm required as a healthcare professional to come in and see patients, and most of them are emergency patients, and we have to wear our gowns and our masks, our screen, so that people can be protected. We do all the things of like the temperature. We even do the swabs, but there are instances where there's a potential of being exposed. Now, as students, and I don't know if some of you are currently doing rotations, but when you're not at your rotations and you're not wearing your gowns, when you're not wearing your shields, if you know that you're being potentially exposure is there, is that something that you as a professional feel that you need to bring forward at work when you go to work? Do you feel that you are required to let your employer know if you have had some exposure? I mean, not maybe directly, but maybe somebody was in the room with you. You may have been 6 feet apart, but he ended up having COVID-19. Would that be something that you might go to your employer and say, look, I think I've been exposed. I'm going to have to go into quarantine. Or would you say, well, I don't really think I was exposed to it. I was far enough away from that person. I don't feel sick. I feel pretty good. I feel very healthy. I don't have a temperature, and continue to go to work and say nothing. So, you have to think about these things, and some of you might be thinking, well, of course I would tell, but there are people that would rationalize this and maybe not think it was as dangerous or as important for you to do it, depending on how you view that exposure. I recently read a very interesting article about, I have become very interested in traumatic brain injury. And I was reading in a brain injury magazine, and they were talking about how, because now traumatic brain injury is like the Wild West, in that there's not a lot of regulations when it comes to facilities opening up, especially when you're talking about personal injury cases that are being evaluated by a lot of different people. I always thought it was mostly neurologists that dealt with personal injury, traumatic brain injury. But that's not the case, and it's because of the way the funding of reimbursement for testing is. It's not typically something that is ran through the insurance, like Medicare or Medicaid, or a workman's comp necessarily. It may be a separate venue, like through a legal case that may arise, which a lot of those personal injury cases are. So as a response to that, there are quite a few people that are interested in kind of delving in this area. And I was reading an article, and I came upon a pediatric dermatologist who opened up a facility for treating children with TBI. That was an example that was given. In this case, it's a physician, but it's not. But they're not neurologists, but they are physicians. So by law, they're not necessarily obliged to send those cases to a neurologist, even though it's probably not in their scope of practice for dermatology. And because of the structure of the fee schedules and how people are paid in this particular area of personal injury, they are okay to open that up. That is when I say okay, that there's not a legal issue in them opening up a facility. Is there an ethical issue? The next thing I came up with was something that we all probably have come across, and I know I have in my career, but how many of us have had to conduct testing panels that may not be necessary? If you're working In some facilities, there's a requirement and a protocol for every patient that rolls through that door. Even though you, as an audiologist, a doctor of audiology, may feel that it's not necessary to do some of these tests, this is a requirement, and this is something that maybe the employer, or if you're working in an ENT office, or you're working with maybe your audiologist, doctor of audiology employer, may have a certain testing protocol that they expect you to abide by, even though you may feel that some of the testing is not necessary. Is it illegal to do something like that? Well, that could be a gray area, and we're going to talk a little bit more about that. But on the other side of the coin is, is it also an ethical issue? So, we have 3 different scenarios that I've just thrown up here, and there's a number of other scenarios we're going to go over too. But each of them have their own distinct flavor to them. The first one, the COVID one, it's not illegal. It's not against the law, but it's certainly an ethical issue here. And this is where your conscience comes in and how far you can rationalize something. The second one isn't against the law, but it is very much an ethical scenario. The third scenario that I have on conducting testing panels could be something legal, potentially. But I think there's a greater ethical issue here. So, you have to kind of decide how you would handle these things, because at one point or another, you may be in any of these scenarios, not maybe a pediatric dermatologist, but you may be in a position where, there's some affiliation of some sort. So let's go a little bit further into ethics and talk more about this. So I'm hoping that, let me just move this panel away from me. I am hoping that my objectives for this webinar is, number one, to differentiate ethics versus law and how laws are created based on ethics. As I mentioned initially, ethics changes. We're a young profession. And I know you guys always hear the historical reference to when in the 1960s, late 1960s, audiologists under ASHA were not allowed to sell hearing aids. It was not against the law, but it was an ethical violation. And at that time, it was frowned upon, but it wasn't against the law for you to sell hearing aids as an audiologist. You had to get a hearing aid dispenser license. But if ASHA found out that you were selling hearing aids, even with a hearing aid dispensing license and being an audiologist both, you were basically kicked out of the professional organization. And so, that has changed. The ethics there has changed. And many of our laws are based on our ethics, of how we view our practice and how we do our scope of practice. Laws are designed for that. That's why you have to have certifications and licensure in each state if you're going to practice in that state, and what is required from that state for you to be a licensed audiologist. So a lot of what we believe our profession should be ethically, our conduct, and what we should be doing, scope of practice, is very much related to what how our laws are designed. And as you know, we continue to fight for those laws and to update them. Our current fight with Medicare and updating Medicare and helping us become more autonomous. So ethics and laws are hand in hand, but the penalties that go with it are different. I also would like to look at laws that affect our practice of audiology that are definitely available, and they're laws that we need to follow in our practice, and we're required to upheld. I am hoping to define some terminology related to ethical principles, and I think that this is going to help guide you when you're making your decisions on whether you're doing something ethical or not. And I wish everything was so easy, you know, it's either is or isn't, but that's not the case typically. Typically, there's a gray area, and sometimes it can be very confusing, and if you don't have the understanding of how to view these gray areas and how to judge whether you should be abiding by the principles of ethical principles, it's difficult to adhere to them. So I'm hoping that the terminology that I'm going to present to you will help. I also am going to I presented 3, but I wanted you to more or less to think about that as we move forward in this presentation. But I also wanted to define current ethical dilemmas that you may come across. And again, I'm not here to give you answers for this, because a lot of times ethics, well, most of the time, it's something that you have to make that judgment call on. I can help with advising as a mentor, or if you have mentors, but it's a difficult area to really come down and say yes or no to. I mean, there are conducts that there are things that we have available to us so that we can look at those documents to be able to determine whether we're following things as we should. So I'm hoping that by the end of this, I will provide those resources and help you assist in solutions to ethical dilemmas. Okay, so let's look at ethics versus law, and I kind of just put a rough little comparison here to help. When I think of ethics, I think of moral guiding principles, a basic code of behavior, and we do have professional guidelines that are available, that our professional organizations have available to us. When these things are violated, if there is an ethical violation, it is not usually punitive. It is not, you can't typically go to jail. You will, on occasion, if there is an ethical violation, be placed before your professional organization, and potentially you will be reprimanded if there is a conduct violation under the code of ethics is involved. So professional organizations are typically responsible for ethical conduct. On the other side of the coin, we have law. Laws are usually from state and federal. I mentioned it about licensure. State laws, every state is different. And you have certain set of laws that you have to abide by in order to be licensed. They are based on our ethics. They are protective mechanisms for society, for our patients, the consumer. That's what they're designed to do, protect. And if you violate a law, the consequences are punitive, and there are fines and imprisonment potentials. So there's definitely big differences between these two areas. I have presented 3 different laws that I feel that are very, very important in what we do and how we practice. And these are very much laws that you will come in contact with. The first one is the Stark Law, and I don't know if you've had an opportunity to go over some of these laws, maybe in any of your professional issues class in your university. If not, I'll introduce these to you. If you have, this is a good review. The Stark Law prohibits physicians from self-referral or financial interest. So a good example of this is if a physician asked you to come to his office and potentially rent, and again, this can go into number 1 and 2, but rent from him or her a space to do audiology if you have a practice. The contingency is if you're renting from them, they will strictly refer to you, and you will maybe not have to, you may have to pay him less or maybe more than market value for those referrals in the rent, through the rent. That's one way of looking at the Stark law. So it's a self-interest thing where he's only referring to you because he's going to have some kind of financial gain, or she's going to have some financial gain from you being in the office and monetarily providing them with because of the referrals that they're sending. Or maybe you'll give them 10% of those referrals. That's a Stark law violation. It is not a violation if you rent from a physician, but you have fair market value and it's strictly a separate business in itself. There is nothing for that physician to gain from it, from you, then that is not a violation of Stark. So it is a possible arrangement that you can have, but it has to be very above board. It has to be, there can't be any exchange of money under the table, because for every referral that he sends you, you give him some extra money, like a 10% or something like that. That cannot happen. That is a violation. The other one that you may be very well aware of is the anti-kickback statute, and this presents as a preventative statute to providers from accepting bribes or any kind of remuneration in return for Medicare, Medicaid, or federal health care program business. So what does that mean? Well, you know, a lot of the, you know, we talk about this with manufacturers, trips on the basis of how many hearing aids you sell. And this is also a very good example about ethical changes and things, and this law. You know, 15, 20 years ago, it was not unheard of for hearing aid manufacturers to offer trips to their customers, audiologists, hearing aid dispensers, if they sold so many hearing aids that allowed them to go on certain trips, certain European trips. I mean, some really nice trips. And I mean, it was very, very considered a pretty luxury type gift. Although it was, you know, you paid for it with your hearing aids, and that was okay. It was very much okay. But over the last 15 years, things have changed, not only from the medical point of view, but also from audiology. I mean, we kind of followed suit with medicine. You know, medicine was also doing the same thing. Doctors were being wined and dined, given things, given monetary things, given material items, trips, lavished kind of things. And it was not against the law, and it was not unethical. So with the anti-kickback statute, we've changed things quite a bit. And anything that you might be viewed, it may be viewed as a bribe, that is considered a violation of an anti-kickback statute. Finally, the last is the False Claims Act, and that's pretty self-explanatory, and it's basically falsifying any kind of testing that you may do. If you didn't do it and you went ahead and falsely charged the patient, that is a False Claims Act, and that is against the law. And you know, these are things these are three major laws that affect us, and we are abiding by these laws in order to practice and being ethical as well with this. So it's important for you to know them, and I just wanted to bring them up so you either refresh your memory about them and be aware of them, but also kind of show you the difference between the ethical and how they are kind of shaking hands with each other, because you have to be ethical to abide by these laws as well. Okay, so let's talk about the principles of ethics. And medicine actually has four. I have two extra ones in the principles for us. Autonomy, veracity, justice, beneficence, and non-maleficence, as well as fidelity. These are kind of like the foundation to ethical principles. And I'm going to break these down for you so you can understand what they are. Physicians actually have four, and their main four are autonomy, justice, beneficence, and non-maleficence. And these are the main pillars for medicine. And we're going to talk a little bit more about this. But let's define them a little more so, and let's go into autonomy. I know we talk a lot about autonomy, but you know, we're a young profession. If we compare ourselves to other professions like medicine, for example, I mean, the Hippocratic Oath was written in the 5th century. Optometry was officially began in 1872. Physical therapy was 1887. Dentistry was 7000 BC. And now audiology, 75 years. That's a pretty big deal, you know. I mean, that is a young profession. We are in a young profession. And we're moving and trying to be more autonomous and working together to try to do this with changing the laws. But autonomy is a guiding principle, and it helps us to be self-governing. So if you're not autonomous, then you're not I don't think you're as responsible. You know, if you're going to have self-governing when you're autonomous, you are responsible. You have certain responsibilities to patients. That's why there's licensures and certifications that have come about so that we can enable the autonomy and also support our scope of practice. When you're looking at licensures versus certifications, there's a difference. I think very often they get confused, but they're still important to supporting autonomy. But there are differences. So if we look at licensures, you know, most states require you to have a license to practice. Minimal standards for practice and legal recourse. That's one of the reasons why you have the license, so that there is some kind of legal recourse if you aren't doing, you know, if you're not providing if you're not doing your trade and your profession. And then also with licensures, you're looking at fees are paid to the state. With certifications, it's a little different. It's more voluntary. You're looking at getting a certification potentially through a professional society or renewed periodically from the society, you know. And that's different than continuing education, okay? Continuing education is very often required for licensure, but not so much for professional organizations. Usually continuing education units are required by your state. That goes along with renewing your license. But if you're looking at certifications, you can get certifications with things, and it can go through your professional organization like AAA and ADA. if they provide courses or certifications with tinnitus or with precepting or vestibular certifications, that really goes in line with more your professional organizations approving them. It's not a requirement from a licensure point. But autonomy is important, and that's one of the ethical pillars that I like to discuss and bring to your attention, because we are a young profession and we are trying to move in the direction of being self-governing, and that means being responsible for your profession and your conduct. Beneficence. Beneficence means that persons providing treatment have the obligation to do good for the persons they are treating. Now, I believe in my heart of hearts, and as a professor and as a fellow audiologist, we all have gotten into this profession because we want to help people, and we want to do something good for people with hearing loss, with people with vestibular issues. We want to help people. And I believe that the majority of us have gotten into this. I think that we need to remind ourselves all the time that we have an obligation. It's not just wanting to help people, but we have an obligation. If we are going to be self-governing, which is autonomous, and if we're going to have the ethical conduct in beneficence to move and work and treat patients, we need to have professionalism, meaning the way we conduct ourselves with our patients, with our office staff, our peers, and with the way we work in our profession. We need to have the evidence-based practices. Interestingly enough, when I was researching for this webinar, one of the articles that I read was written in 2017, and it was basically it was in Audiology Today, and it was about clinical practice report card, and the report card was on adult treatment rehabilitation. Interestingly enough, when we're talking about, and I know you've heard this, but real ear and using self-assessments and knowing how to use telehealth and things like that. These are all things that we as professionals are obliged to do to provide evidence-based practice. But unfortunately, the majority of our profession is not doing that. And so beneficence is suffering here. Again, it's not a law, but it is an ethical obligation to provide the best for your patient. Appropriate referrals, making sure that you are sending patients where they should be, and as well as if you feel that you don't have the skill set to treat patients the way you think, or maybe you don't have the knowledge in certain areas, you have to have the beneficence to appropriately refer those patients. Why? To do good for that patient. Treat the patient with the utmost respect and give them the highest regard and give them the best treatment. So I think it's really important for this term to be kind of highlighted, because this is why we got into this profession, because we want to help treat patients, but we also want to do good. We want to do a good job for those patients. That's our ethical responsibility. Non-maleficence. When you're looking at non-maleficence, what is that? Well, I think it goes back to the Hippocratic Oath, do no harm. So we want to avoid that. Well, how can we do that? Our standards of conduct relating to training. Well, a lot of universities do not provide cerumen management. But this is something that our scope of practice includes. So you could do it, but if you don't know how to do it, if you're not trained to do it properly, there's an ethical concern here that you potentially can hurt a patient by not knowing how to properly do this procedure. And I think that this is where, learning skills and being able to do what we are supposed to do with our scope of practice, there's a difference. If you don't know how to do it, don't do it. Even though by your licensure, you may be able to do these kind of testing, but if testing and procedures and things like that. But if you don't know how to do these things or you don't feel comfortable, there's a potential that you could do harm. And that affects overall concern as far as patient outcomes. And again, we're talking about appropriate referrals, making sure if you don't know or you don't have an idea how to do some of the things that even though your scope of practice says you can do, that you would put the patient before your ego and refer that patient. So I highlighted the fact that the potential harm exists when inappropriate services are provided and treatment is not monitored or does not reflect the patient's or the participant's idea and interests. I think another thing about do no harm, and I do want to mention this, is in professional conduct, is making sure that there's a consent from the patient. If you're going to do things that may not be insured, for example, you have other procedures, like for example, cerumen management, which is not currently being reimbursed by Medicare, that you have an ABN and you can have the patient sign a consent to do this procedure and know that they have to pay for that procedure, as well as some other testing like a VHIT or tinnitus management. If there's an expense to that, the patient needs to know, and there should be some way of having an agreement with that patient. That's where I think that we have an ethical responsibility to have a consent form. Again, this could also be a legal issue as well, but foremost, the reason for it would be because you are being responsible and you don't want to harm the patient and you want to have beneficence and do what's right. So this is certainly something that this is a term that you should become very familiar with. Fidelity, keeping promises, having some kind of relationship with the patient so that they feel that they can trust you. And I mentioned patient consent with this as well, because we're looking at the proper testing that's being done. They're trusting you with their care. So you have to provide them with some form of treatment plan. You have to make them aware of payments if there are payments for things. You have to be honest about what tests will provide, what the treatment will result, and what the outcomes are for that. And I feel that fidelity is extremely important in our field, because in the areas of hearing aids, there's some skepticism there with patients. There's so many things out there as far as ads and what kind of hearing aids there are, and so we have to be able to justify and help them understand, why we charge what we charge, why there's a certain treatment plan, why we're doing certain types of testing, and providing them with all the information they need so that they can feel comfortable with the things that you've mentioned to them that you would like to do for them, and what your treatment plan is. So fidelity is extremely important. Justice, that means equality and fairness. When I put this in, justice, I mean, we often think about law and everything, but you know, we need to have equality and fairness with all the people we work with and the people that we see. I mean, there are biases. You have those patients that you just love that walk through that door. When they come through the door, that makes your day. And there are patients that are a little more challenging. And you need to, be sure that your bias isn't getting in the way of how you treat those patients. Your attitude needs to be in the back seat, and professionalism needs to be in the front. You never, and when I say never, what I mean is you need to put yourself in check ethically, because even we don't want to do that. It's not something I believe that we mean to do, but we're human. And if somebody strikes you the wrong way, that has to be in the back seat of the car. And you have to make sure you remember that you are there to give a certain standard of care. There has to be some objectivity to it. Your attitudes and your bias need to be on the side, and there has to be a professional conduct and standard and non-emotional type of relationship there in decisions that you make. They need to be objective and not subjective. And the way you take care of one patient needs to be the same for another. You have to be consistent and remind yourself, because it is an ethical concern when you have certain biases towards patients, certain biases towards employers, certain biases towards employees. We all have to put ourselves in check, and that's a daily thing, I believe, because you have all kinds of personalities. The majority of the people that you see, you can get along with just great, but there's always that 1% that roll through the door, and that's when you really have to kick it up. So justice is extremely important, and the same goes with how people treat you as well. So these are concerns you need to think about. Veracity, being truthful and honest with interactions with patients. That means treatment options, making sure you present all the treatment options, not allowing your own financial gains to get in the way. If you are getting commissions for hearing aids and you're tempted to maybe this patient, to go with something that is more expensive because there is ultimately you'll get a higher commission, that's unethical. Going beyond your limits of specialty or going beyond your scope of practice, that is not being truthful and honest. Making sure that your patient expectation of what your role is realistic, and what you can and cannot do. Some of your patients may think you will be able to prescribe, drugs, medications, and you're not an MD, you're not a medical doctor, and so that's where you present yourself. You're a doctor of audiology, and you have to explain that to them, truthful and honest about what your level of expertise is and how far you can go with them. So we definitely never want to step outside our boundary in our profession, but we also want to be able to be truthful and honest with patients so that they know what the expectation can be, how far you can go with what your treatment plan is, and how they will do. Giving them false hope is not going to be a good thing for your relationship with them, and it's not ethical. So I also have kind of presented you with some way of looking at these different scenarios that come up. And ethical dilemmas, I guess that's a better term. But now that you have some idea about the pillars, I call them the pillars of ethics, for us as professionals, you can maybe now look at some of these dilemmas that on a pretty common in our field that you'll see, and how you can approach it and stay within your ethical bounds. You know, it's easy to know your laws. Laws are easy. You know, you don't want to break a law. That's an easy thing, but ethical dilemmas are not as easy. So I've kind of written a couple here, and I don't know if you have some that you could add to this list, but some are kind of straightforward. There are practice loans from manufacturers. If you're going into private practice, that is a route that some people choose to take. And practice loans have, you know, for manufacturers have certain obligations typically, depending on the loan and how it's written. But in most cases, there is maybe an obligation of selling a certain product for the manufacturer's product, 80% versus 20. That's a gray area. And there's a lot of discussion about how this can be viewed. Some people say, I don't feel this is unethical because this is a manufacturer that I really, really, you know, I've worked with their products. I believe in what they do. I believe in this. I would promote these regardless of whether I was getting a practice loan or not. Other people look at this as, you know, things change, and depending on how long your loan is, I mean, what if the product changes, then what would you do? Are you going to use a different product if the product isn't up to standard, or if another product comes out from a different manufacturer? Is that going to give, are you not providing your patient with the best product possible, especially if there's a newer one that's better? So, you know, it can go either way with this scenario. At the moment, I don't believe there's a legal issue here, but that's not to say it couldn't happen. It's a gray area for sure. Lunch or dinner from a manufacturer is considered an unethical thing, and it is also a violation of the anti-kickback law. So very often, you know, there's education that's tied into it, at which point there no longer is a anti-kickback law because it's education promoted and they're serving dinner. But you may feel like there is an ethical issue here because they're still providing you with dinner. Gifts from patients. I don't know. It depends on where you're working. If a patient just thinks the world of you and they bring you a present, is that against your ethical? Is that against an ethical concern here? Is that causing you to be biased towards that patient? Are you getting some type of gratuity for the work that you're doing? Gifts from patients. Well, it's very obvious hearing aid manufacturer education trips, but is it? I mean, that's the same with the dinner, and they're still being done where you're invited to go somewhere and there's an educational program available, and you know that your room, board, and food is covered. Now, they're very strict now about this kind of thing, and there's certain things that they do expect for this educational trip. So I think that they really, when I say they, manufacturers are really trying to be above board with this and keep it legal. But it also could be an ethical concern for you. We talked a little bit about conducting panels of hearing testing and it's considered more of a protocol or routine rather than individualized. And that's something that you as a practitioner have to determine how autonomous you are, and that you can go to the employer and discuss what your feelings are about and your ethical concerns about doing things that you don't feel might be necessary, and that you should have the capability of doing the testing according to how you treat the patient. Patient favoritism, I kind of touched upon that. And we all do it, you know. We all have our favorite patients. We shouldn't be doing it. We shouldn't be having favorite patients, but we're human. So that's something you do have to really kind of, I've actually worked with people, doctors of audiology who I truly respect. But they have favorite patients, and they may not like your patients if they need to see them. Remember, I had a couple offices and people working for me, you know, there are certain patients they didn't want to see because they just didn't know how to handle them, and they didn't want to see them. They denied seeing them. They would pass them off to me or somebody else, or you know, just say, I just don't think I can see those patients. That's unethical. It's just flat unethical. You need to be able to see these patients and provide the same care. Same goes with employee favoritism. I mentioned financial sponsorships and education. You know, you have to be careful who you are getting your sponsorships from. Even commissions for hearing aid sales. Okay, there's a lot of you who are going out into the field, and that may be part of their benefit package. There's commissions that go along with that. That's an ethical, potentially ethical, that, you know, you could look at it as a business benefit package. Commissions are part of it, incentives, which may not be a bad thing, but is that going to skew or cause you to, your treatment plan to be different, or what you would want to promote? Discounts, when I say that, it would be like if Mrs. Jones comes in and she's not sure she can afford to buy the hearing aid, but she really wants to buy it. If she would just get a discount, that would just be, that would do, if I could get a 10% discount, that would be great. And you give her that 10% discount so you could make the sale. Mr. Jones comes in and you don't offer him the same discount. Well, that's unethical. And, you know, that's something that you need to really work through, because as an employer, that would be something that would be potentially, there could be maybe some legal issues there, but it's a violation in that it's unethical, and you would need to set precedents and have it in writing that this is how it needs to be done to ensure that this isn't a violation of your practice. And it's an unethical kind of scenario, but it happens. Reporting patient abuse, that is ethical responsibility you have to that patient. If you are seeing a patient and you think there's potential abuse, whether it be elder abuse, whether it be a child, domestic, are you going to report them? That's something you have to determine if that's what you're part of your ethical standing. If that goes under the justice and as well as the fidelity, being sure that you would oversee those patients and give them the best care that you can, including reporting abuse if you see it. Making sure that you're transparent. And meaning, if you decide you're only going to use one manufacturer, you know, you need to determine that, and you need to make sure your patients understand why that you've decided on that. I think transparency is very important. I just gave that as an example, but you might have other examples you can think of for that. So we're come to the last part. I wanted to conclude this with a short YouTube. And this is from a medical point of view where they're going to be discussing the 4 principles of ethics as far as how doctors, MDs look at this. And I just wanted to highlight it so you could, again, kind of reinforce what we've talked about throughout this webinar. So let's do that.
Is it a problem solver or one more problem? Master your business.
Hello, my name is Dr. Hart Pinto, and we're going to talk about medical ethics, the 4 prima facie principles. So what are the 4 principles? They are based upon 4 common, basic, prima facie moral commitments. They provide a simple and culturally neutral approach to ethical issues in clinical practice. It also aids healthcare professionals in decision-making when reflecting on moral issues that arise in the workplace. The 4 principles are autonomy, beneficence, non-maleficence, and justice. We will consider each individually. Autonomy is also known as self-rule. It is the capacity for patients to think, decide, or act on the basis of their thoughts and decisions with freedom and independence. Therefore, in order for us to respect autonomy, doctors must permit patients to come to their own conclusions, whether or not we agree with them. They should still be respected. Beneficence means to actively do what's best for the patient. The principle is based upon an objective assessment of a doctor and what they feel is best for their patient. A doctor's decision may be in conflict with a patient's own views and therefore can clash with a patient's autonomy. Where a doctor overrules a patient's decision, this is known as medical paternalism. In practice, this never occurs. Non-maleficence means to do no harm to our patients. When we operate, we aim to do what's best for the patient, or in other words, beneficence. But with surgery exists risks, such as thrombotic events and even death. Therefore, in everyday practice, we must weigh up the possible treatment decisions with risk versus benefit, or beneficence versus non-maleficence. Justice is the principle that all patients with similar circumstances should receive the best and equal treatments. This forms a key factor in service allocation. By providing increasing services to our accident and emergency departments, is it just to restrict funding, therefore, to mental health services? In reality, time and resource limitations means that not all patients receive the best possible treatments. So in summary, our day-to-day practice as doctors involves the fine balancing act of weighing up each of these core principles. Autonomy, again, is the patient's right to decide on their own treatment. Beneficence is our act to do what is best for the patient. Non-maleficence is to do no harm to the patient. And justice is to ensure equal access to treatment. Thank you very much for listening.
Okay. And finally, I just have written down some ethical resources that you can refer to, and all of our professional organizations have code of ethics. Your state licensure rules and your scope of practice wherever you will be practicing may not have ethical resources, but you should know what the licensure is for your state and what your scope of practice is in that state, and they are different. You need to remind yourself of the 3 laws I've introduced you to today. Those are laws that you will be responsible for abiding. And then, of course, your mentors. You always have mentors that can help, because like I said, most situations that you will come across ethically are pretty gray. If it was easy, most people wouldn't be as interested in ethics as they are. But ethics changes, laws change, your scenarios change that you have to be concerned with. And hopefully now you have some kind of basics. You understand what your responsibilities are in an ethical dilemma, and you know the resources. And that's all I have tonight. Does anybody have any questions?
Thank you, Dr. Hugert. It doesn't appear that we have any questions in the queue at this time. So I think we'll go ahead and wrap up. Thank you to everyone who attended, and thank you for everyone that is watching the recording after the fact. If you have any questions, please email them to info@audiologist.org, and we will forward the questions on to the presenter. If you have friends and colleagues that were unable to attend the webinar today, please let them know, like I said, that the session has been recorded. We will send a link out to attendees after the recording is posted, probably sometime later this week. For more information about future SATA practice management webinars and to register, please visit audiologist.org/students. Thank you, everyone, and have a great evening.
Thank you.